Well, once again, welcome to another edition of Land and Legacy by Griffith Realty. I'm Scott Griffith, president of Griffith Realty, and Carol, my sister, is here, who's the vice president. And we are really excited today and honored to have John O'Malley, the CEO of, I'm going to try to get this right because there's been a number of names, it's not Trinity Health Livingston and Trinity Health Brighton Hospital. I think is the way it goes. So, am I close, John?
Yeah, you're pretty close.
Okay.
Trinity Health Livingston Hospital and the Trinity Health Medical Center, Brighton.
It's been through a number of names. And as a historical part of this, I guess the legacy part of this, Carol and I can both say we were born in the system in the McPherson Hospital when it was the McPherson Hospital up in Howell.
Road.
Byron Road.
Last year they opened, as a matter of fact.
My mom was quite proud of that because she later was, for a short time when they still had a board of directors at McPherson, on that board. And Carol and I are very proud and pleased to have been part of the evolution of the hospital in Livingston County. I mean, we all agree having healthcare close, having our own community healthcare system is just remarkable. We've had it for so long, and it's amazing how good it's gotten. And so John's been particularly had the most significant mark, I guess I would say, on the system that I can remember of bringing the healthcare and making it a community healthcare system again, not just an acquisition that sort of like has good healthcare, but making it back to a community healthcare system that's still part of a big system. Don't get me wrong, I get it, and we have a little bit of a legacy because in the day that the system wanted to expand into Brighton, I had the pleasure of working with them to selling them the old Woodlands Golf Course, which many people will remember, and to this day some are disappointed because there was a golf course that opened when the frost was still in the ground and stayed open late, it was challenging in its own ways because it was a kind of a cow path type golf course, but it was a golf course. But it became something so much more important to all of us. And today, we all know so many people who've had health care done there, particularly cancer. We were involved with the Cancer Center as it came into fruition, and we're proud of that. And so, John, thank you for being here. There's so much big things happening, even more than we've ever thought could happen.
Yeah, I'm overjoyed to be here with you and Carol, and I'm looking forward to this.
Yeah, so, I referenced how much you've done already, and I guess you've cast such a wonderful vision of how we can have total health care in Livingston County, and you've managed to bring it here and expand it. Maybe you could talk about that success a little bit, if you would.
Yeah, no, absolutely. It started, and it isn't really so much myself as it is, Trinity Health's been just very supportive of everything we wanted to accomplish out here in Livingston County. And 7 years ago, we put together a plan working with not only Trinity Health, but our sister organization, IHA. And so one of the things we realized was we really didn't have enough primary care in Livingston County. So we made, at that point, a $90 million investment where we brought IHA out in our Howell location, which is the IHA location on M59 Highland and Michigan Avenue. And then, of course, our East Brighton right down the street here. And then we also have South Lyon, Pinckney, and Hamburg. And so we really brought a lot of primary care so that, we could really serve the community effectively in that regard. We then began to move towards, with that, from a full-service community hospital perspective, and keeping, and you've heard this, I think, perhaps, in the community, local care local.
Yeah, I think that's the vision you've been casting that made a difference.
And I mean, that's really predicated on bringing a full-service community hospital to Livingston County.
Yeah.
We have such great sister hospitals in Ann Arbor and in Livonia and in Oakland that we use for more acute patients that are related more to a tertiary or a quaternary medical center.
Sure.
Something we would never do here, like we're never going to do open heart surgery here.
Right.
Sure.
So, and that just makes sense that,
Sure.
it's being wonderful stewards of our resources that we have.
Yeah.
And so I think, what we've done over the years is we've grown our primary care network out here so that we've given more access to the community. We've then brought in specialty and subspecialty service. We've grown general surgery, bariatrics, urology. We've grown orthopedics, not only sports orthopedics, but general orthopedics as well. We do a grill. We have now, I think, 4 or 5 orthopedic surgeons that service our area here.
And so us aging folk need that.
Well, and, you're right. You're right. And so what we're trying to do, we do every 3 years a community health needs assessment.
Sure.
So we try to identify exactly what the community needs. And then we tailor the healthcare we're going to provide around that.
Nice.
And so, in doing that, I think that's been really... I think it's a combination of both of those over the last 7 years that have really led us to a point where Trinity Health looked at, what we're doing out here. And, let's face it, St. Joe's, what used to be St. Joe's Livingston Hospital, now Trinity Health Livingston Hospital on Byron Road, built back in the mid-'50s, it's tired.
Yeah, I mean...
It's tired. And we need a new state-of-the-art hospital. What's really nice about what we're proposing here to do and what we received approval of through our Trinity Health Board last week was $238.2 million investment we're going to make in Livingston County to relocate that hospital to the campus of our Trinity Health Medical Center Brighton. And it's going to be attached to Trinity Health Medical Center Brighton.
It's amazing.
And, it's going to consist of, it's about 174,000 square foot hospital. We're going to open with 56 beds, but we are providing a great deal of opportunity for growth. So we have an area that's going to be shelled for 16 beds. We have another area that's shelled for either 24 beds, or if, for some reason the deliveries in Southeast Michigan and Livingston County take a turn and start going north quite a bit, then that's space that could also accommodate an OB service. But so it's really going to allow us to have a robust campus consolidated in one site to better serve the community instead of being a bit fragmented like we are right now.
Well, and I know if anybody's paid attention, there's been a commitment to try to do this before, and there have been many extenuating circumstances almost every time a economic return that has changed the course. But you and I have actually talked over the years, and there's always been this, if we could just consolidate it where we are versus trying to find a new location, it would be really helpful. And here you are, you're doing it, and isn't that exciting? I mean, this is the logical solution, right?
It really is.
Yeah.
I mean, it really is. It's that location is very easy to access. You're not having to really drive through a lot of subdivisions. Now, grant you, that decision back in the 50s to put it there was fine because there weren't homes around there.
Right.
It was sort of out.
Snow farms.
Yeah, exactly.
That was the urban area.
Yeah. So I mean, that was the right decision back then. But times change. I think
population
we know that. Population grows, and in our discussions with, for example, Livingston County EMS, they love the new location because they can get patients there very quickly, and it's ease of access for everybody from that location, not far from 23 and 96. And the other thing you should know is we're actually working with MDOT. We're working with some of our representatives to see if we can, when they start construction on that interchange, that we can really have great access for Livingston County EMS and others that need to get access to the hospital on Grand River, since that's really going to be right down the street from the hospital now. And they didn't know we were obviously building a hospital there. They do know now. So I think that'll be great. And it's just, guys, you need to make sure we keep accessibility to that hospital on Grand River there as you're doing your construction.
in other podcasts we've done, we've talked a little bit about how the reconstruction is going to take place, and can you fathom the impact it would have on a new hospital if you had accessibility? So that's wonderful. It's you're way ahead of the ball. Most people don't even remember that there's going to be a reconstruction, let alone a hospital. So now they got both. So yeah. So that's the one thing that's always struck me about that location, and it's just a really good regional spot. I mean, the success of your cancer facility there has been it's almost a merciful thing to have it at such a convenient location for serving Livingston County in the region around it. You don't have to go to another urban center. You can come to the crossroads of two expressways and get treatment for something that maybe you have to go a lot for, because some of the treatments require a lot of visits. That's been wonderful, and I think now to be able to have the full-scale hospital operation there will be amazing.
Oh, it will be. The cancer center has been incredibly successful there in serving the community here, and we're involved in so many trials from all over the United States in that cancer center, and a lot of folks here don't realize that the patients we treat there are getting very high quality care. They really
actually.
are. Oh,
I didn't
okay.
know how
Carol knows the
invaluable
treatment.
it was until I had an
issue,
it was phenomenal.
It's
experience.
a gem.
And I didn't have to drive. I didn't have to spend overnight somewhere where you don't feel well. And
then even our father went through it.
Okay.
And again, to be able to drive down the road, go get your treatments, and go home.
Yeah.
What an amazing gift to a community to be able to get that in your backyard.
Well, and we've done a number of surveys out in the community to just try to get a handle on the pulse of what they really want and what they believe they need. And the big thing we get back from the community is they don't want to travel.
Yeah.
They don't want to. Now, I think they understand if you come in the ED and you have an event and it's a service we just don't provide. We'll never provide it here in a small community hospital. They understand you need to go to, and we'll get them to Ann Arbor or wherever safely.
The specialty is, yeah.
And so I think they understand that, but it's just something that's the kind of service we want to provide the community. We want the community to trust us, rely on us. We want to be their healthcare provider to make sure we keep you safe, and we provide the very best high quality care we possibly can. And I didn't bring data with me, but I can share data with you from 7 years ago to today that shows our quality's increased dramatically out here, and we're very proud of that.
So since you're going to literally be building a new hospital from ground up for the care side and these new things, what are some of the new things you see in a hospital today? I blessedly haven't had to be in a hospital too often, but I'm sure that there's an evolution. What are kind of some of the things you see incorporated into the new hospital that you're going to like that's going to be unique?
Yeah, I think what we have, one of the things we have, which is kind of cool, is acuity adaptable units.
What does that mean?
So what does that mean? What does that?
Know.
What do you guys mean?
Sounds great.
These are really rooms with a treatment model that allows all stages of the patient care to come to the patient.
Oh, nice.
So now what we do is if you're in ICU, which we didn't have an ICU 7 years ago, and we do now. We have
That's
an ICU.
amazing.
It's just,
that's amazing.
Today.
Yeah, when you think
and,
of that, yeah.
and so we've really progressed very quickly in a short period of time. But right now it's something. If you're getting better, you're going to go to step down. You might even go to medical surgical unit or medical unit.
Sure.
So you're transferring. You're moving.
Yeah, I was going to say I think everybody moves down
and
from
you
their
kind of
intensity.
move. Yeah, exactly. Exactly.
Yeah.
And so what the acuity adaptable units are is you don't move. When you're admitted, that's where you're going to be. And we're going to bring the care to you. And what that really does is no more transfers.
Sure.
Reduces and decreases medication errors. Infection rates go down. And medical complications go down. So there's really a huge benefit to doing that going forward in the community. And so we'll have pods of 8.
Sure.
And our nurses are just really excited about this. They're really they're looking forward to the new state-of-the-art hospital, and it truly will have the latest technology out there in this facility. So, that's one thing. I mean, some of the other things we're doing, we're really expanding our women's health. Our women's health is you'll be able to basically, for the most part, get everything done here, with the exception of the event of giving birth. We're not going to bring that back when we open in 3 years.
Sure.
And I'll tell you the reason for that. The reason right now for that is birth rates are on the decline pretty significantly overall.
Yeah, it's actually remarkable. We had a conversation a few minutes ago that they've been going down pretty regularly statewide, and they expected a blip from the COVID, and it was a very minor bump, and now it's back down. So it just keeps going down.
Yeah, it just keeps going down. And so, our thought process around all this, and we've done a lot of research. We've got together and we have outstanding OBGYN physicians here locally. We continue to add additional OBGYNs to this community. I believe we've hired 2 or 3 more here.
I know a number of them live out here, and they're recently wonderful people. Yeah.
Yeah, and so I think your pre and postnatal care is second to none out here. I think it's outstanding. We have great doctors and mid-level providers. I think the other thing that you'll see out here is our women's health. When you take a look at our current our mammography center in Brighton right now, which, by the way, we are expanding. We're going to grow
Nice.
that footprint there. But we're going to add 2 on-site radiologists specializing in breast imaging, 3 mammography rooms with the option of adding a 4th, 2 centralized ultrasound units in that current location, a larger bone density exam area, and stereotactic guided core biopsy.
Sure.
We're adding all of these services, and we want to care for the women in the community and their families. Now, let me go back a little bit to births.
Yeah.
We've talked about how they're declining. Okay.
Yeah.
If you go back far enough, 2 out of 3 women back when McPherson had OB in the community, 2 out of 3 didn't deliver at McPherson. And so we looked at some of the reasons why, and many women decided to choose, I want to go where there's a neonatal intensive care unit in case there's something wrong with my baby that they need to go into that unit. I don't even know how many there are. There aren't many small community hospitals that have that type of unit.
Sure.
They're very costly to operate and to run. They're very costly to staff. And most, I think, physicians or mid-level providers, midwives, they want to be in a much larger hospital that, quite frankly, delivers a lot of babies, like Trinity Health Ann Arbor. They do over 4,000 deliveries a year.
Amazing.
They have a nationally recognized NICU.
Yeah.
And so for that one event, they really need, we really need. And the other thing we need to keep in mind is their OB-GYN out here follows them to Ann Arbor.
Right. That's the one thing I could say is even true with our family. That's exactly what happened.
Yeah, the continuity of care in that regard is phenomenal here with Trinity Health. And so, I look at that and I, as much as I'd love to have OB here, it just makes all the sense in the world. And even from a safety perspective, to make sure that patient gets to Ann Arbor and delivers appropriately, and if they need that neonatal intensive care unit, it's there.
Sure.
Instead of here, and then I have to transfer them and the baby. It just, I think it's better care if we can do that. But with that, we need to make sure we're providing great women's health care and the very best pre and postnatal care possible.
That's cool.
So that's really what was behind that whole decision. And I honestly hope the community understands that. I know they're passionate about the OB unit that was at McPherson and that was at St. Joe's, I think up until 2010 maybe. But it really, I think the way we're setting this up, and let me also say this, and like I said, I think a little earlier, I couldn't remember if it was before the podcast or after, but we are shelling space for growth. So if something were to change, and again, all of a sudden, first go through the roof, again, community, we're going to take a look at that and see if we need to, in fact, bring OB back. So
this will be about a 3-story building from what I saw of a rendering. Is that correct? 4-story.
4-story.
Nice. Yeah, it's going to be beautiful. I saw a quick rendering on some public relations release or something and thought, wow, pretty impressive. So, back to the quality of life that you're able to provide us by having such a facility. We're blessed to live in a community where people can have access like this, to be able to age here and not have to sort of suffer and just make a decision about, if I age here, am I giving up my ability to stay healthy and stay vibrant and all? And what you've provided and the direction that you're taking us to give our community, let's face it, it's an investment by a system. They hope to get a reward, but boy, does it reward our community. So it's a beautiful thing.
And, let me tell you something else that's really kind of cool that is not going to be available when we open the new hospital, unless we can raise some funds that perhaps we'll also contribute to as Trinity Health. But so we're bringing what's called intensive cardiac rehab to the new site.
Sure.
And part of that, we have that already now at Livingston Hospital, and it's hugely successful. A lot of our cardiac patients exercise there, and they learn how to eat better. There's a teaching kitchen, there's yoga, there's exercise, there's all kinds of things for them, and it's a very busy program. And so we're bringing that to, we're going to move that.
Sure.
But what's neat about it is we're positioning it such that in the future, when we can bring a hoop house.
Oh, yeah. Actually start growing.
Yeah, and start growing, vegetables. And we're going to draw the community in and show them how to do that and how they can grow and eat right. And then we're going to have a walkway that connects them to the teaching kitchen. So then we're going to bring them into the teaching kitchen. And so it's not just the cardiac patients, it's going to be the community as a whole. We're hoping really to partner with some of our local farmers out here.
I say you're taking us back to the connection that it started with. The farm hospital is going to become connected back to the earth where, frankly, it's where it started here when we started a hospital, right?
Yeah,
going back to where we've been, right?
Exactly right. And so I'm excited about that.
That's cool.
We have, we're investing $238.2 million in the community, along with a lot of additional jobs coming forth. We do have a $5 million philanthropy goal that we're going to be kicking off in the new year, and you'll probably hear more of that from Lindsay Dabalski.
Sure.
Who I believe you know.
We know Lindsay well.
And so I mean, some of that could go towards that, and I think that's just really exciting that we're making this type of a commitment and investment in the community. And we're not asking for a ton of philanthropy, but something that we think we can use to do some of these things. We're going to have also an exercise trail.
That's nice. Yeah, you got land there. That's good. Yeah,
around the hospital.
Sure.
And that was, again, the land you mentioned. I mean, that's one of the reasons why we went there also, is there's a lot of land there for us to do this. And then a lot of things in the future. A lot of room to expand. And so we're excited about that as well. So,
well, we just can't thank the hospital enough for deciding to make that investment, because we know the benefits to the community. I think it goes both ways. You talk about philanthropy. I think the community should and would like to help invest in making sure those things come about. So I hope that we're a generous community back, and that it's a win-win for all of us.
I hope so.
Yeah,
I mean, that's the goal. I mean, if we're working together, we're going to be successful.
And the people there are part of the community. The one thing you could say about this hospital is these are not people who drive in. They are the people that live here who work there, and it's great. So it's people our locals taking care of each other. So it's really great.
Exactly. And I learned that, 7-8 years ago, initially, I didn't live here, and I do live here now. And so,
funny how things change. Yeah.
But you learn that, and it's kind of what I enjoy about it is I get to go out. Well, first of all, you've got a lot of chamber events. You've got the Rotarians and their events, and then the restaurants and what have you, and you always see somebody.
Yeah, we have a great social fiber. We do.
We have a wonderful social fiber.
You just need to.
But on the other hand, when we're selling the community, the hospital is number one for us. We drive people by and say, heaven forbid if you were having an event or you were sick, this is where you're going to go.
Right.
And it's world-renowned medicine.
To be able to show the convenience of it's phenomenal.
So, we just have so many jewels here in Livingston County, and the hospital's one.
Yeah, and it's something that too, and I'm so excited about. I was talking to some of the nurses today that have been involved in meetings regarding the technology that we're going to bring to the new hospital, and they're so excited about it. They're just they can't wait. It's like, why can't we get this going?
I'm sure. I bet. Yeah. When you know what's on the horizon. So I gotta say, we want to thank you for what you've done, your vision, what you've done. I can't thank your staff, the people, the doctors, the nurses, the entire staff. You've created a wonderful environment that people can appreciate. It's a great place to be treated and to have treatment and to know people. And again, thanks for having Trinity Health and being able to make such an investment in our community. We're as blessed as anybody by that. So thank you.
Well, thank you
and
both.
Thanks for being a guest.
Thank you both for having me on your podcast.
Yeah.
I appreciate it.
Pleasure.
This is all possible, and I have to give kudos to not only our staff at the hospital and at our Trinity Health Medical Center, Brighton, all of our staff, but our physicians as well.
Yeah.
And I think that the confidence the community has in our capabilities to provide, outstanding, high quality, great customer service care to this community is something that we're really working hard to strive to achieve.
It's working.
And I think we're getting there.
Yeah, I think so too.
I think we're getting there.
But so thank you, John, for being our guest today.
Thank you, Scott. Thank you, Carol. Appreciate it.
Thank you for watching another episode of Land and Legacy by Griffith Realty.